When I was a child, I used to reason like a child, meaning the way that I saw childhood illness was very exploitative. Like, if I can fake a cold, then I won't go to school. If I get a real cold, I won't go to school, not knowing that colds can actually kill and that other kids who are not as fortunate as me are experiencing real childhood afflictions, real illnesses, and real death. Studies and statistics have shown that in 2022, South Africa experienced an average of 32.2 deaths per 1,000 births. That is a large number when we look at the value and the life that is inside each and every child. The leading causes of death in children under the age of 5 have been found to include pneumonia, malaria, diarrhea, as well as birth asphyxia and preterm birth complications. Now, at the rise of COVID-19, the public was told that children do not get infected with the virus, at least not terminally or seriously. But we have, however, seen cases of children who have died from COVID-19, children who have suffered from the virus, even babies. Now, how do we deal with the virus we're not prepared for as the world at large when it zones in on the most vulnerable bodies in our communities? Living in the climax of pandemic has now brought us to a place where we are realizing actually children don't have that much agency over their health. As we come into conversations about vaccines, as we come into conversations about infection, about treatment, there's a lot of debate around who gets the say, who gets to decide that my child has to get the COVID vaccine. If a parent can give gene therapy or gene enhancements to their child, if parents should test whether a child will be born with gene mutations or illnesses or diseases, who should decide which children get to live and how they get to live their lives? So we're hearing conversations in the media, we're hearing conversations on social media, which is a huge platform for the public right now to be discussing these matters of, does the government get to say? And if the government gets to say, how far does their authority go? When we really honestly evaluate those sayings like it takes a village to raise a child, do they stand true? Do they stand true in 2022? And if we are not that village, who holds the parents accountable? Who gives them the information that they need in order to make sure that their child is well taken care of?